Hello everyone. In this INR number 32, we are going to discuss about another important topic called as atrial flutter. So this is arrhythmia topic, atrial flutter. So what is atrial flutter? It is a rapid succession. Remember, it is a repeated and rapid succession of same type of identical consecutive atrial depolarization wave. So that is what I am saying, rapid succession of identical consecutive atrial depolarization wave. Because of this consecutive identical depolarization, you can see consecutive identical depolarization of the atria, you are seeing P waves are giving a sawtooth appearance, right? So that is what I wanted to say, that because rapid succession continuously it is contracting, so same type, that is why P wave is looking same and they are giving you a sawtooth appearance of the P wave, right? So rapid succession of identical consecutive atrial depolarization, so same type continuously occurring and they are giving you a sawtooth appearance of the P waves because they are contracting faster. So obviously ECG, if you look at the rate, they are showing you regular rapid atrial rhythm, right? So you can see that RR interval is same, so these are having regular rhythm, right? So regular rhythm, but the rapid atrial rhythm will be there. If you measure the heart rate, you will find that it will be in the range of 250 to 350 beats per minute, right? And from where this arrhythmia starts, so this arrhythmia is starting from because of the re-entry circuit. And where is the re-entry circuit formed? Remember, this is important MCQ also. So re-entry circuit will be mostly from the tricuspid annulus in the right atrium, right? So when you see the re-entry circuit will be starting from the annulus of the right atrium. So tricuspid annulus in the right atrium circuit has been started, and now this is why this will be giving you P wave, which is the consecutively they are getting increased and they are giving you the sawtooth appearance, right? So that is the important thing. So when you see the ECG of atrial flutter, so what you will note, you are going to see the sawtooth baseline. So you can see sawtooth baseline because of consecutive contraction, right? Because back to back identical P waves are there. So you can notice here after 1 2 3 4, then till now it has not gone to the ventricle. Now from here, the after fourth contraction, it will be going to the atrial, to the ventricular depolarization. Now the ventricle is contracting, so that is why we will call this as a 4:1 AV block in this ECG, right? Because every fourth atrial beat is transmitting across the AV node. So then they are seeing that QRS complex is coming. So 1 2 3 4, and then it is transmitting to the ventricle after the AV node is passing this to the ventricle, right? So that is what we are going to see. So what we are going to do a treatment for this patient. So remember, vagal maneuver will be there, like a carotid sinus massage. Why we are doing this? Because it will give temporarily decrease in the ventricular rate. So temporarily it will decrease the ventricular rate by increasing the refractive period at AV node, right? So this will increase the refractive period at AV node, and that is what it is going to decrease the ventricular rate. That is temporary, right? What is the definitive treatment? So vagal maneuver is temporary. Definitive treatment is restoration of the sinus rhythm. So how we can restore the sinus rhythm in this patient? By giving AV blocking drugs. So AV blocking drugs are beta blockers, non-dihydropyridine calcium channel blocker. So this beta blocker, calcium channel blocker, these AV blocking drug, what they will do, they will slow down the ventricular rate. That is the importance of this AV blocking drug. So we can use antiarrhythmics class 1A, 1C or 3 also. We can go for cardioversion, and the final thing is the catheter ablation, right? So catheter ablation of the region between the tricuspid annulus and IVC, where that re-entry circuit was formed, you remember? So that catheter ablation will be definitive treatment in this.